Well, now the Dean of the School of Medicine at the University for Development Studies, Professor Stephen Tabiri, says Ghana needs to take a step towards training more doctors to fill the gap created as a result of the recent exodus of doctors. He spoke during a visit to the Techiman Holy Family Hospital by key members of the department as part of a joint venture to increase the intake of medical students in the university. Correspondent Anas Sabit has more in this report.
In recent years, doctors, nurses and other health professionals are leaving the country in droves to seek greener pastures in countries that pay good money for their services. The situation, according to the Ghana Medical Association, is largely fueled by poor working environment coupled with low pay, a situation President of the GMA says could weaken the health sector if proper measures are not put in place to avoid the act. To help deal with the menace, the School of Medicine at the University for Development Studies is collaborating with the Techiman Holy Family Hospital to train more doctors to help bridge the gap. Professor Stephen Tabiri is the Dean of School of Medicine at the University for Development Studies.
The purpose of this gathering is to look at how we can increase the number of doctors in Ghana for the agenda or the project of providing universal health care for all Ghanaian citizens, irrespective of where you live. In order to achieve that, we need to increase the number of doctors that we are training as a nation every year. How do we do that? One institution alone, one university alone cannot do it. The only way we can do that and the only way to achieve this is to work together with the institutions, coming together, looking at the strength of each institution, and then looking at the weakness of each institution, and then come together to support each other in order to increase the number of doctors for Ghanaians.
Professor Stephen Tabiri noted that stopping these health professionals from traveling out of the country would be a difficult thing. However, training more doctors would help address this worrying menace, and in turn, the country would have a substantial number to provide the needed health care to the people.
It's a worrying development, and we cannot also stop them. There will be some mechanism we'll try to stop them, but it may be difficult. The only thing we can do is to increase the numbers. So once we are doing this partnership, that will give us the opportunity to increase the numbers so that even if some are going to leave, we're still going to have a substantial number that will provide the needed health care for Ghanaian citizens.
For the Techiman Holy Family Hospital that is aiming at becoming a teaching hospital of excellence, the partnership would go a long way to help achieve this feat. Dr. Jacqueline Asibe is a senior pediatrician specialist at the facility.
The vision of Holy Family is to be a teaching hospital of excellence. So if we get medical students on board, then it's really in line with our vision. Because the good thing is if we train the medical officers, they become doctors, some would want to come and do their internship there, MOs and specialize. So it's going to be a great one for us. So we get bigger and bigger. And then as is in our vision, we become a teaching hospital of excellence. So it's such a great collaboration for us to get the medical students on board.
The Assistant Archbishop of Techiman, Most Reverend Dominic Yeboanyako, on his part, assured the two institutions of the support of the Techiman Diocese to help realize this dream.
Be assured that Techiman will offer you the best of clinical training experience. Again, be assured of my personal support and the support of the Catholic Diocese of Techiman in the successful implementation of this agreement for our mutual benefits and Ghana at large.
Anas Sabit, Joy News, Techiman.